Welcome to BNE, Leadership and Management in Nursing 2. And today's topic is Kenya's health management structure. And my name is Dr. Jane Karonjo. Our objective today is to describe the national functions under the Ministry of Health and explain the functions of health services management at the county level. And the third objective is to outline the technical management of health services at county level. Introduction. Kenya's health system has undergone significant changes. With the promulgation of the Constitution of Kenya in 2010, the health care services now reflects the interlinked levels of national and county. National functions of health services at the Ministry of Health. One is to develop the national policy, set standards, report on national level issues, provide supervision, and coordinate sector directions and mobilize the resources. It also offers technical support with emphasis on planning, development, and monitoring of health services and delivery standards throughout the country. The national function also monitor quality and standards of performance of the county governments. And as we are aware, we have 47 counties in our country. Then the national function also include provision of guidelines on charges for the provision of health services. So county governments are given guidelines on what to charge for the various services offered at the county level. The national government also conduct the studies required for administrative of management purposes. Like now when there is an outbreak of disease, the national government will move to the counties and help in conducting studies. We also have health care services management at the county level. And there are several roles and responsibilities at the counties in provision of health care services. And one of the responsibilities and functions at the county level is the delivery of county health services. And at the county level, we have several health facility units. We have level 5, we have level 4, we have level 3, up to level 1. The county also has several other facilities, health facilities, like private, non-governmental clinics. We have also faith-based health facilities. And it is the role of the county government to license and accredit non-state health service providers. And the county government also, they have financing of the health services in all their health facilities at the county level. At county level, they are also responsible for maintaining and enhancing and regulating health service providers, health service providers, approving county special partnership agreements for county health service providers, So the county government at that level, they are given autonomy. Unlike in the past, when all the decisions were being made at government's head office in Nairobi. Now at our county government, they are able to source funds from outside with their partners to support provision of health services in their counties. Now, in collaboration with the national government, the two levels, the national and county, they coordinate, they consult each other with the national government, they gazette regulations for community managed health supplies to be implemented at the county level. Like now, the overall in charge of health services of the Kenya government is the Ministry of Health, but they consult with the counties in planning and in the provision of health services. At county level, because they are autonomous, they can plan investment and asset ownership. They can own assets all aimed at the provision of public health facilities so that they can provide quality health care to their citizens. So at the governor and his team, they are able to own assets and to fundraise for the provision of health care. Also at county level, there is channeling public and other funds to develop health facilities. They can fundraise. And when we are posted out as to work in various counties, you find their developments. They start facilities, they start departments at the county level to expand because of demand for care. They can put up health facilities through the funds they receive from the government and through their own fundraising and the taxes they collect at the county level. And then at county level, they also collect information on implementation of projects, and they also document so that it is available in case of any need to share with the national government. At the county level, we have technical management of health at the county level because everything has been devolved. Some of the services that were being provided by the national government has been devolved to county level. So at county level, there is a professional and technical management structure that is established in every county to coordinate the delivery of health services through network of facilities at the county. As we have mentioned earlier, there are several facilities at the county level. The team consists of several units. At the county level, the professional team, there is an office of the county director of health. And there is also a unit, disease prevention unit, so that at a county level, if there is an outbreak of a disease, then that unit is responsible for coordinating the service. Then there is a medical services unit that is concerned with the provision of those who are hospitalized, those who come to health facilities for daily care. That one is for that purpose. Then there is a health promotion unit, and that one is responsible for ensuring that the county community remain healthy through health promotion. And there is a unit called the Planning and Monitoring Unit, so that all the health services are coordinated, they are planned well, and then the resources are provided. Then there are several functions of county level health management team. As you know, we have a population of 47, at the moment 47.6. That is our current population. And each county has a number of functions related to health promotion. And one is to coordinate operational planning, support supervision, monitoring, and review of health service delivery in the county. Then this team is responsible for coordinating delivery of health services, and they also provide a linkage with the county executive, like the office of the governor and the cabinet secretary and other actors to facilitate health sector dialogue at the county level. Most of the time the counties lack essential supplies, and there is provision for linkage between the county and the national level, so that they can work together to ensure the provision of health care at each county. This team is also responsible for mobilization of resources for health services, because at county level, with the autonomy, they collect the tax, and they are also given allocation from the national government, and to ensure that service provision is attended. They coordinate the referral function across the health facilities in the county and between different levels of the health system. So at the county level, we have several units. Some are small, like dispensary, the dispensaries, health centers are level 3, level 4, and they coordinate the referral system. Those from the small or health units, they refer difficult cases to level 4, level 3, and when need arises, they can refer to national hospitals in our country, like Kenyatta National Hospital, or other specialized health facilities. As we have discussed today, it is very, very important for nurses to understand the health delivery system for each country, because as you graduate from your program, you become global nurses. You go to different countries. It is good to understand healthcare delivery system so that you can work effectively without confusion. There are times that you need to refer patients to different levels, and it is good when you are aware how the healthcare delivery system is organized. If you are in a county level, it is important to know the roles of the various organs within the county in times of consultation. After the program, some of you will be heading those small units, bigger units, or even level 4 units. And if you understand the health system and how it is organized and the functions of the team members, you'll be able to refer, to consult, and even to resource supplies for provision of care. Most of the time, you'll be faced with the acute shortage of supplies at even ward level. But if you know who to consult in times of need, you will be able to work effectively without confusion and with less stress. So at this point in time, we hope now by now you'll be able to describe the national roles of our Kenya government in provision of health care delivery system. And in summary, we have said mostly is the policy, the policy formulation. They also oversee, the Ministry of Health oversees the health care provision throughout the country. So sometimes the system is organized in such a way that there is a continuous consultation, there is a linkage, so that the counties will not work independently because of the health care for the Kenyan citizens is an interest of the government, and therefore they are allowed to have the link between the government and the county. Sometimes the government will identify a need, and the county level they are not able to provide. Sometimes you see the government buying equipment, especially the most expensive ones, like renal dialysis, maybe respirators, setting up intensive care units. And so at county level, when we are coordinating nursing services at the county level, then it is good to understand that the Ministry of Health at the national government, which has the mandate for the health of the people, has a responsibility of the health of the people even at the county level. And then the county level, once they receive the resources, they are also responsible for providing quality care with the resources they are given. But in times of shortage, there is a link, and there is a way of liaising with the national government to support, like when there is an extra demand, maybe emerging diseases that they have not planned for, that they don't have enough staff and the resources. They know there is always a way of going back to the national government for help. So that is the technical team also at the county level is responsible, as we have said, in the provision of quality care at the county level. And they are responsible for licensing. You realize at the county level, you have faith-based health facilities, you have non-governmental health facilities, you have private clinics owned by clinical officers, by doctors, by nurses. The county technical team, they are responsible for licensing those individual practitioners at the county level. Sometimes they can even close those clinics, those that do not provide quality care, or those who do not observe the guidelines of provision of care, like those who engage unqualified staff. So the county government is responsible. The county government is responsible to ensure that all those who are providing health services at the county level, they are qualified and they are following guidelines like infection control. They supervise those clinics, even if they are faith-based. They make regular supervisory visits to those health facilities to ensure that the people at county level are being given care by qualified personnel following guidelines. Like in the case of there is an outbreak of a disease, this professional team at county level, they are responsible for monitoring and evaluation and management and control of that particular outbreak. So we have said the technical team is headed maybe by a cabinet secretary of health at the county level. And we have said although there is a devolved power, devolved services, they always work together with the national organ in provision of health services. Some of the members of that technical team at the county level is maybe medical superintendent, and maybe nursing officer of health services coordinator, public health officers, and so on. So today's session is at that level, and next week we'll continue with the other unit at nursing leadership and management in nursing too. Thank you.
These televised lectures supplement our robust online learning going on our MKU online platform. You can view more on our televised lectures via our online platform. We are in a digital era, and Mount Kenya University knows this. The following are the steps to follow so as to complete your online application. Download the application form from the website www.mku.ac.ke. Attach copies of your academic certificates and ID. Pay the application fees via M-Pesa pay bill number 270988. Your ID is the account number. 2,000 shillings is the charge for a postgraduate. You can also deposit in the bank accounts provided on the website. Then email all the above to apply@mku.ac.ke.